Welcome to the Jill on Money Show. It's Saturday, August 17th, and we are here trying to help you make better financial decisions. You know how we do that? We encourage you to go to our website. That's jillonmoney.com. And when you go there, in the upper right-hand corner, there's a button. It says Contact Us. Click that button and a form will pop up. And that's the email that we receive. If you would like to join us on the program live, all you need to do is check the box and mark the best executive producer in the entire world. We'll do everything else. You know, so many of you have questions about retirement. We thought we'd bring you a special guest this weekend. We've got Ryan Viktorin, who's a certified financial planner and a vice president at Fidelity. And Ryan is here with us to talk about this big report that comes out every year from Fidelity about healthcare costs in retirement. So I thought we would bring someone on from the team at Fidelity to walk us through what was this report, what did it show, and how we can break down this number, $165,000 of healthcare costs in retirement. It's just astounding. Right now, this is the first part of our interview with Ryan Viktorin. So you are joining us today, certified financial planner. Mostly, we're going to enter into this conversation through this report just out from Fidelity, the Fidelity Investments annual retiree healthcare cost estimate. And so, what is the, again, the average amount that a 65-year-old who retires this year can expect to spend on health care and medical expenses in their retirement? What's the number?
Well, I got to prepare you for a sticker shock, right? And this is why we actually do this every year. So just like you said, for the average 65-year-old, it's about $165,000. I know. And what we actually find, part of this survey is that, and, and I see this anecdotally in the work that I do every day with, sitting with clients and building, financial plans, but that the average American estimates about $75,000 for, their costs for healthcare. So they're about, half of what they really will be. And I know that number can be staggering, which is why we want to prepare people now and make sure that they, as they build their plans, they're ready for it.
It's wild because when you think about it, I think a lot of people are like, oh, I just get Medicare, right? And that'll take care of everything. So let's drill down a little bit about what this $165,000 actually encompasses.
So, I mean, really it's, and what I will say, we'll give some high level here, but Medicare is complicated, right?
Oh my God. So complicated. And we're going to talk a little bit about that, but let's start with where does the 165 come from?
Yes. And there's a really important distinction with when we say medical costs and healthcare costs. So there's multiple parts, like you said, parts A and B, okay, which is usually where most people, think of first. And it, wide variety of costs that are covered by that, hospital stays and the standard doctor visits. But then there's things called supplemental plans, Medigap plans, all these other jargon-filled terms that nobody understands until they start to tackle it. And again, we'll go into some of the detail later, and I'll provide some resources. But that's going to cover things like any, prescription costs. It could be dental care. And then, what could be out of pocket for all of those, different things that's really offered. What's really important to point out, though, is that number that I was talking about before, that 165,000, doesn't include long-term care costs, which is a whole other pile that we have to add on to it. And again, we can talk a little bit more, but I want to make sure that I make that distinction as well.
So when you think about this, I went on to just to prepare for you. I don't want you to think that I'm, just phoning it in. I went to the Medicare website, which, I mean, how much fun could that be, by the way?
Right, hilarious.
And so I looked at Medicare Part B, which starts at, let's just call it $175 a month. And then there's a deductible of $240. But then, and by the way, this is supposed to be 25% of your estimated average per person cost, but whatever. Okay. So then, of course, if we have listeners, this drives them bananas because if they have too much income, then they're also subject to IRMA, the income related
Irma,
monthly
yes.
adjustment amount, horrifying.
Yes.
But so the Medicare part, right, that people are
Mm-hmm.
paying, that 175 is really just a fraction. Like obviously, if you're
Yep.
paying a couple $1,000s a year, it's not adding up to 165. So according to you guys, with Medicare A and B accounts for about 43% of the total 165,000. Then you
Mm-hmm.
say prescription drugs, another
Yep.
10%. But
Yep.
what does it mean when you say all other healthcare costs, which is, honestly, almost half of that
Yeah.
165,
Yep.
co-pays, co-insurance,
Yep,
deductibles?
deductibles. Exactly. Hospital visits, things that aren't covered outside of that. It's just the things that you wouldn't really think about. And I guess when people are working, some people have access to what's called a high deductible plan. And
Hmm.
so they have a cost in their paycheck that they're paying if they're working, maybe through their work, that it's being provided to them. And then there's the deductible they have to meet
Right.
before the health insurance kind of, kicks in and covers some other costs. A lot of people kind of think that part goes away
No.
with Medicare, meaning it's just going to be given to you and that's all, kind of part of it, when really it is, there are costs affiliated with it. I know when I build financial plans for people, and by the way, a lot of people don't know what these costs are going to be until they come up against, they say, oh my gosh, I'm turning 65. What are my Medicare costs? Like I haven't thought about it yet.
Right.
Hence the reason why we do this survey. But we can definitely use these estimates for as we build out financial plans for clients, where we can start to say, hey, what am I really going to be spending on an annual basis? So that's the other thing I want to point out. When we're talking about costs of 165,000 for, the average 65-year-old, that's also with a life expectancy of 20, 25 years. So it's over the course of your life. It's not like it's this big pile you're going to have to come up with, in the early years of retirement. And so,
yeah, but it's still, but wait a second. You're right. I
Yep.
figured that out also, because I figured like if you're 65 and your life expectancy is 85 or 90, I did the same thing. I went to my little
Right.
calculator and I was just like, well, let me just see, what does that look like? And it's not terrible when you do it on an annualized basis, but
Right.
what it does do is it does actually then, like, to me at least, what it became clear was that I sort of was like, okay, how much is this? I'm trying to break it down monthly. So I was like, it's like $600 or $750
Yep.
bucks a month in today's dollars, right?
Correct.
Every single month. And
Right.
so does that mean when you're building a financial plan, you meet with someone who's 40 years old, right?
Mhm.
And you say, okay, what are your expenses? And they give you their
Yes.
expenses. How do you put this in as an extra expense immediately? Just say, like, I always just say, like, let's put $1,000 a month in as a placeholder. Is that a back of the envelope way to do it? Or should I be telling people more?
Well, so I think it's two things. We tend to use, average numbers for, kind of on the conservative side for everybody. And remember, it's each person will have these costs.
Oh,
right?
yeah, duh.
So
I forgot to say that. We're not talking about a couple. We're talking about one person. I forgot to mention that. Good point.
That's exactly right. And so, and then it could be, when are you retiring? When, let's say we're dealing with a couple, husband, wife, as an example, husband retires first, he's 65, wife is 60. Oh my gosh, she's not ready for it yet. So like, there's all of these different things. And so, the answer is you can use estimates, but as you get much closer to that retirement goal, we're going to, fine tune it. And it's also why building a financial plan for a client they could be 35, 55, 65, whatever it is. It's not like you do this one time, set it and forget it. And you have this inch thick printout that sits on your bookshelf that you never look at again,
Right.
and, collecting dust. This is a living, breathing experience that moves with you, and like any other living, breathing thing, needs to be maintained and needs to be, nurtured and make sure that it's always in line. And so sometimes it can feel kind of scary to say, oh my God, I'm 40. How do I count for this? We do use estimates. We also use estimates for how much it will increase every year, which on average of about 5%. So it's even higher than inflation historically tends to be. So that's kind of the value of working with somebody like me. And the good news, it doesn't cost anything for, at least for, at Fidelity, to sit down with one of us and build, one of these plans for you. So, I always say I may not be 65 heading into retirement, but I've gone through retirement about 1,000 times. And so we can use these averages and the data that we've got both anecdotally for the clients that I've met with and also the data that Fidelity provides, of course, to make sure that we account for it so that you don't have to worry about it.
You say, in other words, you're saying everyone who is approaching retirement, which is everyone who's working. So you're saying like all workers today have to factor in these costs and also know that that these costs are increasing by about 5% a year, right?
Mm-hmm.
How do you factor in? I mean, if you have someone who's rich, we have a lot of rich listeners, not everyone, but we do. So, and a lot of these people are completely freaked about IRMA. And so how do we factor that in? In other words, if someone has a big portfolio already and they're 50 years old, then we're going to know that there will be income that is spun out from that, right?
Correct.
So how do we factor that in? Do we just use a higher placeholder on our annual expenses?
Yes, but that's also an integrated conversation with, from a tax perspective, right? And so, because remember, the IRS just loves being involved in everything that we do, right? It is their favorite.
Yeah.
And so, especially with the clients who do skew where they have, the higher net worth clients who really have to be thinking about this. And again, good problem to have, problem nonetheless, right? That we can try to address. We absolutely can use estimates, but the really important thing too is as you really approach that date where you say, okay, I am done working, I'm going to be on Medicare. The other thing I need to point out is that we have Medicare specialists you can meet with, that you can go beyond just the estimates that we can use. I have to use that from financial planning projections, of course, so we can account for it. But we also have specialists that can specifically sit down with you and figure out your situation when it comes to just Medicare. Then you take that info and it comes back to me and we build it into your plan specifically. The other thing that's—
Wait a second.
Sure.
So when you say that, okay, so instead of me sitting down with my mother and looking at that fat book that I did 20 years ago with her. How do you know you go through this? In other words, so for me, it was kind of like, okay, I had a father who had this pre-existing condition. I knew he was on certain medication. Mom was on other medication. I put it all together and I honestly made my best guesstimate. Sorry, Mom, it was a guesstimate. Are you saying that that they will drill down to that kind of that granular level of like your actual health needs at retirement to help navigate the Medicare application and enrollment process?
They will absolutely sit down with you. It's usually best within about a year of when you'd enroll and really, call it approaching 64, the age of 64. And again, it could be when the first person turns 65, the second person turns 65, the whole scenario, like I said. But yeah, their entire role and their entire history of their career has been working with these insurance exchanges. And so they are specialists across the country in every state. It's available now, so that you can sit down with them. And yes, on a granular level, so that you can really start to see what's the best plan for me. How do I think about IRMA? What do I need to, account for? What am I not even thinking about?
We'll have part 2 of our interview with Ryan Viktorin tomorrow. That's when we're going to really start talking about what you need to do today to plan for these healthcare costs later in retirement. If you've got a question about your own retirement or any other financial issue, go to our website, jillonmoney.com. Click the Contact Us button. Let us know if you'd like to join us on the air live. Also, don't forget to sign up for the free weekly newsletter. It comes out every Friday, a perfect tune-up for the weekend. You can also subscribe to Jill on Money Live. For $35, you'll have access to quarterly live webinars, as well as the back catalog of those webinars and special video content. So Jill on Money Live, right on the website. You can subscribe to us on the Odyssey app or wherever you find your favorite podcasts. Please lift someone up. Change your work, change your wealth, change your life. Thank you for listening. We'll talk to you tomorrow.